and a record of test results. A log of equipment service can be very useful for troubleshooting problems. The service record should include a description of the problem, the repairs made, and the retesting results. A well-kept logbook is a handy reference for anyone who uses the radiographic room. It can eliminate time-consuming searches for information, helping the program to run more smoothly. Number 23. It's easier for program participants to record test data if they can write the information on standardized forms. Test forms should be simple and should allow easy comparison with previously gathered data. The form should record basic information such as the room number, the test performed, and the date of the test. The technical factors such as KVP, MA, time, and distance should be recorded as well. Finally, the form should contain the test results and any comments pertinent to those results. The test film should be filed for future reference. They can provide a useful point of comparison with future tests. Number 24. Maintaining test forms, logbooks, and a quality assurance manual may seem to be an abundance of paperwork. It should be emphasized that this paperwork is not an end in itself, but is used to ensure that the equipment is being monitored and that the participants in the program have a clear sense of what needs to be accomplished. You should now be ready for Review Exercise B in your student workbook. When you have completed the exercise, turn to the answer page at the end of the Review Exercise section and check your work. Then restart the tape. Stop the tape now. You should have completed Review Exercise B and checked your answers. If your score is less than 80%, you should review this material again before proceeding to Section C. A score above 80% indicates that you are mastering the material. Please rewind this tape so it will be ready for the next person to use. Thank you. Multimedia Publishing Incorporated of Denver, Colorado presents Section C of Lesson 3 in the Quality Assurance in Diagnostic Radiology series by Rita J. Cusworth. You should now have slide number 25 in view and be ready to proceed with the audiovisual presentation. The last step in the implementation of a quality assurance program involves expanding the program. Program expansion includes adding new tests and test equipment, developing purchase specifications, acceptance testing, implementing orientation and in-service programs, and auditing the quality of patient care and service to the referring physician. Number 26, auditing the quality of patient care and 6. After completing Section C, you will be familiar with several aspects of expanding a quality assurance program. You will be able to describe several tests and pieces of test equipment that can be added to the program. Identify the information that needs to be included when writing purchase specifications. Describe the procedure for orienting new radiographers. Describe procedures for determining what in-service programs are needed by quality assurance participants. And describe 2 methods of assessing the quality of care a patient receives in the radiology department. Number 27. Periodically, new test equipment and monitoring procedures should be added to the quality assurance program. These additions depend upon several factors, such as the department's budget, the installation of new equipment, the availability of new test devices, government regulations, and the previous success of the quality assurance program. Part of each year's budget should include an allocation of funds for test equipment. As newer, more sophisticated radiographic equipment is installed in the department, test devices and procedures to monitor new radiographic units will be needed. Whenever possible, include quality control test equipment as part of the bid for new radiographic equipment. Government standards and regulations should also be reviewed periodically to make sure that the department is in compliance with equipment specifications. If the quality assurance program is successful and saves the department money, there will be a desire to improve on that success by adding to the program. Number 28. Now let's look at some of the equipment and tests that might be added to a quality assurance program. Any department using an automatic collimation system needs to add a test to check the accuracy of that system. The X-ray beam should not exceed the dimensions of the cassette placed in the bucky tray. To measure the accuracy of the system, you can use a 6-inch by 6-inch by 1/16 inch copper test plate and several empty cassettes of various sizes. The copper plate will be taped over the bottom of the collimator, and several exposures will be made of different cassette sizes used in the bucky tray. The exposed radiographs will be used to measure the system's accuracy. Number 29. For tomographic units, tests should be performed for KVP and timer accuracy, MA linearity, beam alignment, half-value layer, exposure reproducibility, and focal spot size consistency. These tests were described in Lesson 2. In addition, a tomographic phantom and a steel aperture plate are needed to test the accuracy of this specialized equipment. The tomographic phantom is used with the simulated patient phantom to measure the accuracy of the tomographic section indicator as well as the thickness of the section at various exposures. The steel aperture plate, with the hole 3.0 millimeters in diameter, is used to demonstrate the uniformity and completeness of motion of the exposure angle. Also, it is helpful to check for obvious mechanical defects by operating the unit in the tomographic modes while visually checking the smoothness of the tube and film and the stability of the pivot points. Number 30. This digital MR exposure meter is designed to monitor fluoroscopic exposure rates, beam quality or half-value layer, radiographic exposure and exposure linearity, time linearity, and MAS reciprocity. A similar device is available for KVP measurements for a wide range of KVP and MAS values. These devices are easily and quickly used. Tabletop exposures can be made to evaluate X-ray sources both above and below the table. Number 31. This is one of the newest and most sophisticated non-invasive test instruments available. With a series of 5 exposures, this computerized instrument determines KV values, measures the exposure time, and computes the relative MA and MAS values. It also displays exposure rate values and computes MR per MAS values, exposure time, and half-value layer. Hard copy reports of the test results may be obtained with the addition of a printer. This test device is fairly easy and quick to use. The instrument is expensive, however, and is usually practical only for large radiology departments. Number 32. Quality assurance tests and test equipment are not limited to those mentioned in this presentation. For measuring most parameters, there are several test devices from which to choose and several methods of performing each test. A list of available tests and test tools can be obtained from some of the recommended supplementary references listed in your workbook or from your local X-ray equipment representative. Number 33. As the quality assurance program is expanded, thought should be given to developing purchase specifications. According to Dr. William Hendy of Denver, Colorado, quality assurance includes specifications for equipment performance at the time of purchase, verification of performance upon installation, establishing a baseline for operation of the equipment, and implementation of a continuing monitoring program to compare current performance with the baseline established at the time of installation. Number 34. Purchase specifications can be described as a methodical approach to preparing for the purchase of new radiographic equipment. Developing purchase specifications involves writing a proposal for new equipment, as well as documenting the desired specifications for that equipment. Acceptance tests are performed to verify that the equipment actually does satisfy the performance specifications. Implementation of a continuing monitoring program includes performing test procedures similar to those described in Lesson 2. Number 35. Here are several do's and don'ts to consider when writing purchase specifications and buying new equipment. Do include, along with performance characteristics, what needs to be done if newly installed equipment does not meet specifications. Incorporate procedures for correcting deficiencies and a time period for corrections to be made at no cost to the purchaser. Include a breakdown of equipment components and the performance specifications for each component. Identify the method of measuring performance for each component. Acceptance test the equipment once it is installed to verify that the equipment meets agreed-upon specifications. Make sure that you require a detailed maintenance and calibration schedule from the manufacturer to assure continuing performance of the unit. Finally, contact other users of the equipment to verify the performance, reliability, and service of the unit. Current users can often supply valuable information about equipment performance. Number 36. If you do your homework, you'll be able to evaluate reasons why you shouldn't buy a piece of equipment. Don't purchase equipment if the equipment downtime is excessive or if it takes several days to get a part when the equipment breaks down. Don't buy the unit if service personnel have to make several calls to correct a single malfunction. Remember, equipment is only as good as the people who install, maintain, and operate it. The final point is an obvious one, but is often forgotten. Don't buy equipment until you have evaluated the need for it and know that you can use it. Number 37. Let's discuss the last point. It is particularly important to consider the expectations of the department for a new piece of equipment. Will it be used for routine radiography, fluoroscopy, trauma, special procedures, mammography, or a combination of these? For example, a radiographic room that will be used primarily for mammographic procedures requires an X-ray tube capable of low kilovoltage, high milliamperage techniques, and perhaps a molybdenum target. While developing specifications, you must also consider room size. It's a sad situation when radiographic equipment is purchased and upon delivery it's discovered that the room will not accommodate the equipment. Number 38. At a designated time, provide purchase specifications to the X-ray equipment manufacturers or dealers that wish to bid for the opportunity to sell their product. After reviewing the specifications, the vendors submit a proposal or bid that lists the equipment they have available and its cost. Number 39. After the equipment is purchased and installed, conduct a testing program to verify that the equipment meets the agreed-upon specifications. This process is known as acceptance testing. Acceptance testing is important because it helps assure the purchaser that the equipment is actually functioning as specified. Newly installed equipment should not be released for clinical use until it has been tested and any necessary corrections have been made. Acceptance testing data should be recorded in the equipment logbook for comparison with future monitoring results. Number 40. A key element in expanding the quality assurance program is expanding the skills of staff radiographers. New radiographers in particular will need training and orientation when they join the department. The orientation of new radiographers should cover instructions on how to operate the equipment, a list of the positions requested for routine and special procedure examinations, the preferred system for calculating or converting exposure factors, instructions on filling out departmental paperwork, and pertinent information about preparing for special examinations and assisting the radiologists. This information may be incorporated in a radiology orientation handbook and should be reviewed with the individual soon after employment. Number 41. The new radiographer's introduction to the department should include spending 2 or 3 days rotating in a few of the radiographic rooms. Rotation allows the radiographer to become familiar with the various radiographic units with which he or she will be working. The quality assurance technologist or another designated individual can provide instruction. The instructing radiographer will demonstrate a procedure, then assist and observe the new technologist. Errors may then be corrected before the new radiographer attempts to work alone. Number 42. At the end of the orientation period, the new radiographer may be evaluated on the material that has been presented and on his or her performance with patients. Areas that aren't clear to the individual should be reviewed before a permanent rotation is assigned. A little extra time spent during the orientation period results in a smoother transition for the new employee and for the department staff. Number 43. All radiology departments need to develop active in-service programs and encourage their radiographers to participate in continuing education programs.